Hi everybody, my name is Nazli Çınar Saruhan and today I will be reviewing the book named The History of Anorexia Nervosa, The Fasting Girls. The book is written by Joan Jacobs Brumberg and it was published in 1989. The book basically talks about the history of anorexia nervosa, how it evolved throughout the years, how physicians approached it in the history versus today, and how it affects an individual's life. First off, let's talk about the word anorexia. It is coming from the Greek origin and it's in the English language since 16th century. An means without and orexis means appetite. So the word basically means without appetite. It's about physiological and a psychological disorder. To define this disorder in simple terms, it is an act of refusing food and a prolonged fasting. It's mostly seen among younger women, although it can be seen in every gender and in every age group, but with a different clinical picture and fewer cases. Countries like America have discovered this disease as late as 1980s, but to physicians it was known as early as 1870s. So it was way before there was a mass cultural preoccupation with dieting and a desire towards slim body. Back in the day, it has long been thought among priests and physicians that this behavior of so-called fasting girls was a heavenly miracle. Even pilgrims traveled distances to see them because they were considered as holy. A physician back in the day would describe their body as having excessive edema, body hair, and a slow heartbeat. For example, also a famous philosopher named Thomas Hobbes described their body as their belly button touched their back. We might think that anorexia started with the use of social media, but this is definitely not true. Even the book got its name from the girls in the Victorian era, fasting girls. They were believed to be saints and holy. I'd like to give more example on the historical figures and how they acted in the history versus how an anorectic would act in our day. Between 1200s and 1500s, mothers would teach their daughters how to be a lady by eating less food, being polite and tiny. Another example would be Catholic figures. They only allowed themselves to eat delicate things like rose petals. For example, Saint Veronica in 17th century. She only ate 5 orange seeds each Friday. Mary and Beatrice, these two women in 13th century, their throats were swollen in the presence of food, and they were vomiting in the smell of meat. Best known of Saints Catherine of Siena, even they had special kind of starving diets, like eating a handful of herbs. And this was all before anorexia was medically named and defined. Modern day anorectic sentences could follow as, I have eaten enough, I'm not hungry, or I'm full. They are not significantly different from the ones in the Victorian age, which also follow as, I don't have appetite, or when I eat, I feel bad. For many years, physicians have reported the act of anorectic people when they're eating, or to be exact, when they were force-fed. They were taking their phones or calculators like this to calculate their calorie intake, even though they were barely eating something. They even used deceiving methods towards healthcare workers and doctors. These methods could follow lying about they have eaten, throwing away food, drinking amounts of water before weighing themselves, recalibrating scales, or they even went as far as inserting weights in their vaginas or anuses, just to trick them into they have gained weight, but instead they didn't. So, what about the treatment of this disorder? 16th century, and the force feeding has been the most dramatic and the controversial topic of the medical world. But if someone's weight drops to dangerously low levels, they were hospitalized and force-fed, no other way. But in our modern day, they also include the psychological aspect of it, like behavioral modification, nutrition, and body image. They are raising the awareness of the individual, to be exact. But no treatment has been found as effective as the placebo-controlled trials. Lastly, if I have to comment on the book as a whole, I would say the medical world has been too focused on the physiological side rather than the psychological side. Because clearly anorexia nervosa, as well as the other eating disorders, are mostly psychological, that reflects in our physiological side. So, to solve this problem from the roots, the medical world should focus on the mental side.